Welcome to Perspectives. I am your host, Martina, and this is the lovely.
What's that?
Yes, and welcome to our continued series on Shattering the Veil. We've, at this point, you should have listened to two of our guest speakers around their experience in healthcare and as it relates to disparities and white supremacy as they've seen it from their perspectives in their professions. We had Dr. Mejia, who is a physician that's been here in the United States since the early 2000s, and then we had Carmen come on and really do a good overview of how healthcare is a business. And myself and Lyzeth have learned a lot from all of those episodes and just really kind of eye-opening. And I hope you all have gotten a chance to listen or watch or do both. If you have not, we would recommend you go back and listen to those two videos or watch them, or again, do both. Because we're really just going to kind of continue into this series over the next few episodes to look at healthcare and disparities that exist in healthcare. And I think for most anybody that's watching or listening to our podcast or channel, know that this is nothing new. Disparities have been around for quite some time. And so in the next 30 minutes or so, Lisette and I are going to spend some time talking about the history of disparities as they exist in this country, in the United States, particularly around African Americans, but also around minorities just in general. And so, yeah, I think we just get right into it. Lisette, anything you want to say, or we just ready to go in?
I think we can just dig in. I think Shattering the Veil, just that title alone really speaks to what we've been hearing and what we are trying to bring to light, right? Like there's all these things that really impact healthcare. It's not just your diet, it's not just exercise.
Mm-hmm.
Particularly if you are a person of color in this country, like there's all these factors that kind of are a reason why, and we've heard so much about it. And I think today we'll really dig in a little bit to the history of it, of those disparities, particularly from like I think the black perspective, right? Because I think we found a timeline, and I'll be honest, it was I found it or learned about this timeline because I was listening to I was part of a Black History Month sort of kind of learning moment,
Mm-hmm.
and they talked about this timeline, and I was like, oh, I wonder if it's online or who came up with this. I went and looked for it, and found it and was like, oh my gosh, like this is when you see it from the health disparities and the timeline, particularly how it's impacted African Americans, um, and historically a lot of the things that we're talking in the present day
Mm-hmm.
historically have
Yeah.
been there and have and continue to be there. Like that's it's frustrating. It's sort of just like, oh my goodness, why are we still fighting this? And we know the answers. Like, Martina, you and I always say, like, we know
While
the
we're
answer.
here, yes.
We know the answer, but you still just have to ask the question because it's just so frustrating to
Yeah.
see. And I think one of them, kind of one of the things that we looked at the timeline, and we'll make sure to kind of include um, the timeline and the links that we always kind of share in the
Hold on.
description.
Yeah.
Was about the activist Dubois, who talked about in a book that health outcomes for blacks and whites had to do more with living conditions than your genetics. I think that was like 1899. If I'm,
Yep. 1899.
and it's like, wait, we have known that long and nothing has really changed, because as you all, if you have been following us and listening to us when we were talking a lot about COVID, a lot of those same conversations were coming up of like, oh my gosh, it's because of where you live, it's because
Mm-hmm.
of what's your environment, like that's really has led to these disparities and the access around COVID, and the health disparities around that. And it's like, look, this has been somewhere in the book since 1899.
Somewhere. I'm sure somebody probably mentioned it unofficially before he did. And
Yeah,
it's supposed to be around even longer.
and then here we are, 2022, still talking and still trying to rectify that particular disparity, right? Like that particular nuance of like because there's a lot of like your zip code determines your health outcomes
Mhm.
and it shouldn't. So it's just, it's one of those things of like, here we are, 2022. I don't know how long ago from 1899 to 2022 it is because my brain doesn't do math on the on the quicks, but it's one of those things like, man, it's just been too long to still be trying to grapple with this and try to change that. But yeah, I think that that's just one of those things that I know we talked on the timeline. But Martina, I don't know if there's anything in your end from that from
Well, to
that.
help you a little bit with the math, it's a little bit, probably like 119, 120 years, probably give or take. And yeah, since he wrote this book, it was called the Philadelphia Negro, and he explained and talked about these different health outcomes between blacks and whites. And particularly, again, it just got me thinking about 2020, when the pandemic here in the United States really ramped up and we had a lockdown. And still, personally, I was just at a dinner last night and talking to a friend of mine, and she's not American born. And she's been here in this country almost 10 years now. And she was just saying, even for her, coming from somewhat of a war torn country, she didn't realize everything that had happened to African Americans and people of color in this country. And also, 2020 for her was a really big wake up call. I mean, also, she is someone that's not natively born here, so it is somewhat understandable that she doesn't know all the history here in the United States. But we got people who are born and raised here, who also kind of light bulb went off in 2020, and really COVID just really just put everything out there. I mean, I think people got to see how African Americans and brown people, if you had these certain comorbidities or these pre-existing conditions like hypertension, diabetes, so forth, how COVID was affecting those communities. And then people, probably looked, oh, well, why is, hypertension and diabetes such a big part of these communities of colors, which of course you got to look back to all the systemic racism of why a lot of people of color do have all these various health conditions and high cholesterol and so forth. Like, you can run the gamut. And to me, I guess because, hey, I've been black my whole life, I'm gonna be black my whole life. Yes, this is how it is, and I'm completely happy with that. And I guess for me, it wasn't a big thing. And I think, I can speak for a few black folks here. I don't know about everybody. Um, it wasn't like we didn't know what was going on, but so many other groups of people, I think particularly white people and the people who may not be native to this country,
Yeah.
it was like people were just really taken aback by how big the healthcare and medical gaps are here between whites and people of color. Particularly, I think, where you live. Like, if you live in an inner city, if you live in a rural area, if you live in a small, there's all sort of tick marks that affect where you're living and who you are as a person. And to me, that's still like, I'm chuckling because it's just so funny, because these are things that I have always known. Like, I won't say always known, but I knew before 2020
Yeah.
about the disparities. And I do work in healthcare, so I have sort of an advantage to be able to know what is happening. But still, to me, it's always just so interesting. Like, 2020, people just really were taken back
Yeah.
about these things. And I'm like, y'all, this is nothing new. Like, where you been? And it's almost to me where people, white people particularly, have really disconnected themselves. Like, they only, and I guess, all of us in many ways, you only see what you want to see. And that's kind of, to me, that's what 2020 did in many ways. White people were not able to see what they wanted to see. They saw it all. They just were able to actually go behind the veil, I think, a little bit, to kind of see that, well, shit, we in the 21st century and this is happening to people of color. Like, wow. You know, I mean, because Taylor, you looked here in Chicago. I mean, we have, you know, the little white kids out there protesting, going on marches. Not saying our people not out there doing it too, but they were out there. They were out there leading these marches and protests. And it was just like, it's to me, like I said, it's just so funny and so interesting that it's still, like you said, over 100 years since 1899, and we're still in the same place. I mean,
Yeah.
we have advanced, but every time we advance, we take 20 steps back.
Hmm.
Because of course we have white people, or white supremacy, I should say, who are looking at this and like, well, we can't let them get too far ahead. We don't want them to be better than us. Honey, that ain't even what it's about. We just trying to have a decent living, send our kids to school, have access to great health care like everybody else. Why is this? It's just such an issue in this comment. I mean, such a issue in this country. But that's all I'm gonna say about that.
Yeah, I think you make a good point when you talk when we kind of look at like the white supremacy, right, and the reason why we're always, you know, 20 steps behind, 10 steps behind, because it's so baked into our systems, and we talk about that a lot, and but you see it, like you see it just every time when you're like you make an advance, but like these white supremacist uh systems and laws and policies and regulations and everything that's to benefit, you know, white people will always keep us behind. It doesn't matter how much advances you make. It isn't until you impact and you start changing those policies, those laws, and you
Mhm.
really start looking at the leadership that is in, whether it's companies, whether it's institutions, and really start for them to grapple like, okay, what do I need to do? Like, you know, do I need to step away and give black leaders a chance, and do that? I'm not saying you're gonna step down from your position, like if you're a CEO, whatever, like nobody's asking you to step down, but
Mhm.
you do gotta have those voices there to guide and to sort of provide that honest feedback, and allow those, you know, diverse voices to come out, and really let you know, like, here's what needs to happen, or here's what needs to be done, and here's how we do it, and let them do it and take the lead, but pay them for
Pay
doing
them
it.
and let them do it how they see it to
Yep.
be done. Because I think
Yes.
a lot of times we do have the few black and brown and Asian folks that we can get into some of these higher positions.
Yep.
White people, well, obviously white people or the white supremacist systems think that that they put you there,
Mm-hmm.
and then we want you to do it how we want you to do it.
Yes.
And if you're not doing it that way, you're being disruptive. Like, this is not how we wanted this to go.
Oh,
And that to me gets on my nerves too, because I see that in a lot of corporate America. I know that's not what we're talking about today,
that's
but
okay. We'll bring it back.
we'll make turn back. But I see that, and I know that's not just in corporate. It's probably just across the spectrum in terms of
Well, even in
workplace.
healthcare systems. I
Yeah,
mean,
just in
when we
healthcare.
talk about
Yeah,
corporate America, healthcare systems are corporate
they
America.
are business. Like, yes, they are business. And so, but you know, let these people do it how they see fit. That's what you brought them on for, you
Yeah.
know. Um, and if they're doing it differently than how you envision, well, then that's too bad, because these white systems have been doing things how they wanted to do since the beginning of time. And so it's time for something new. It's time to do something different, because we're putting all these band-aids on it and giving a little bit of money here and fixing a little policy here. That ain't doing nothing. That ain't doing nothing. It's just, again, putting this band-aid on it. Oh, it's to say, oh, you know, just to say I did something. But
Yeah.
this ain't helping anybody in the long and down the long run. Like, a lot of things nowadays, there's no sort of sustainability. It's just to say you did something.
I think you bring up such a good point about how people think making these, like, you know, donations or providing, you know, scholarships to students are going to be the answer to kind of balance things out or create equity, or sort of, or are going to lead down to equity. I'm like, how many students individuals haven't gotten, whether it's grant funding, whether it's scholarships, whether it's X, Y, and Z, and we continue to have the same issues.
Yeah.
And it's the same thing with healthcare, right? Like, just because you say like, okay, we're going to, focus on health equity, and we're going to, uh, you know, ask you a few questions when you come in and see if you need food or something, and then we're gonna have a referral system to win for you to have access to food. I was like, great, that's nice, but that still doesn't change or really change the system and the issue,
Yeah.
because then I'll always need that emergency kind of help versus why don't I just get paid enough? Why don't I just have access to the healthcare? What if, because we were like, well, you can expand Medicaid and you can expand all these things. And it's like, but that's only for a certain group of people,
Mm-hmm.
right? And there's all these other people who need access to care and don't have it. And it's always been used as a way to leave certain people out, to not allow them to have access to it, to like, and then, historically it is because of racist, it started off with racist individuals who then created racist policies and systems and regulations, and here we are. Like, so just, we look at sort of, okay, yeah, they knew that your living conditions and not your genetics had a, not always your genetics have an impact on your health outcomes in 1899.
Yes.
And the same is true in 2022. So, over 100 years, nothing has changed because your zip code still determines your health outcomes. There's this thing here in Chicago where they talk about the death gap. There's a book out there,
A whole
that
book.
a whole book that talks about the death gap and talks about how, you know, people who live in downtown Chicago have, longer life expectancy than those that live, just a 15-minute, whether it's train or car drive from downtown Chicago. Like, stark differences, and there's like, I think it's not a 30-year, I think it's like a 15-year a gap.
Yeah,
Um,
yeah. I think it's somewhat shortened actually, which it's still pretty big, but it's shortened, but it's still a gap.
But I do know that there is a 30-year gap somewhere in Englewood. There is a 30-year gap
I have heard
between
about that one.
Englewood
That's
and then I can't remember where, like in sort of that downtown north side of Chicago area. But for those things to still exist, and we know it is because of living conditions, is, I know it sounds like we're harping on it, but it's just like,
well, we have to keep harping on it because it's one of those things where I hate to use this analogy, and I love animals, but you got to keep beating a dead horse. You know, you keep doing it because, like you just said, Medicare and Medicaid, ACA, the Disability Act, Civil Rights Act, all these other things that have come along, they've helped somewhat, I think. But when you look at Medicare and Medicaid, those are very two different systems, and they are extremely difficult for the everyday person to navigate. Okay, there's a reason we have experts who just focus on Medicare or who just focus on Medicaid or who just focus on disabilities. Those are very difficult areas to tread. And I think some of that difficulty is also a systemic issue. I think some of it is probably built that way to keep people confused.
oh, for
And
sure.
it doesn't have to be as confusing and as difficult as it is. And it always feels like that it's always just a band-aid to cover something up. It's like, why do we have to have all these different departments and different systems instead of just having the universal health care that we talk about on here? Just
Yeah.
like what, why is that so difficult? Now understand, there's a lot of logistics that goes into that. It's going to be a lot of money that goes into that. People,
Mm.
people are going to lose money. Well, mainly big corporations and big pharma and all these different institutions are probably going to lose money. But what is the cost? We keep going round and round in circles, these same damn issues we've been talking about for over 100 years. And it's like, if we don't make things any better, then we just gonna keep repeating the same thing over and over again. And it's just a perpetual cycle. And And it's not just white people. I think Black and brown and minority folks, it is a lot to deal with. It's a lot to understand. Um, and people are tired. They're exhausted. And yet, folks are like, why can't we just go walk in and see the doctor? Why can't I just go get that eye exam? I gotta go to this, that, and another. I gotta see if my insurance is accepted. If not, I'm gonna be paying out the ass for that. And that's if you got the money. And so it's just, there's a better way to do these things. We don't have all the answers. We ain't trying to have all the answers. We're not the experts in all of these things. There are people out here who are the experts in the field. We got this is a very wealthy country, despite what people may think and what's happening. We're just sitting on a gold mine here in the United States, to me, to be able to really do something about this. Because again, we're gonna be talking about the same shit 100 years from now. The same shit.
I hope not.
I'll be dead by then. But I'm just saying.
No, I mean, yeah, like, yeah, it's just one of those things where I always ask, I ask myself, like, how do we change things? Like, what needs to happen, or how do we get out of this? Because I don't think we can survive another 100 years with the same things and the same sort of issues and lack of things, because people are getting frustrated. We're getting tired. It just doesn't, what's the point? Like, they talk about, I mean, a lot of people like to, talk down about millennials and Gen Zs and the upcoming generations, because we're like, we don't want to deal with this. We don't want to, like, they're like, oh my God, they're lazy, or like, they don't want to. I'm like, y'all promised us a certain way of life, and y'all said we do these things, and it didn't happen. And I think more so, like, definitely, like, the younger millennials and sort of the Gen Zs are like, yeah, we're not going to accept these same things of doing things just because that's the way it's always been done. But it's always met with resistance, right? Like, there's this resistance to be like, let's move forward. And I think it's the same thing with healthcare. You have these younger generations who are like, why are we paying an astronomical amount of money to just have health insurance to begin with? And then you're not covering this or that, or I have to, like, get referrals or pre-approval, or I got to do this or I got to do that in order to get something, or you don't cover it because it's out of network, or because it's whatever it is, or it's, inpatient, outpatient, like all these terms. And it's like, this is too complicated. Like, why am I working so hard for somebody else? It's not even for me. Paying health insurance, and then you can't even ensure that when I go, everything is covered. And then I always wonder, why do we have different insurance for vision and dental? Like, to me,
girl, don't we? I think that shit is so fucking ridiculous.
I'm like, it's
you talking to a person. I was just trying to make an eye appointment this week, and literally, it's not. I don't have the same medical. I think like you're saying, most of us don't. We have different insurance for different. Why is my vision not the same as my medical and the dental? I don't understand that. That is silly.
It's in my body.
Right. It's all connected to one person. Why I have to have 3 or 4 different insurance for this? Like, this doesn't make any sense.
It's a business.
It is. Healthcare is a business. Healthcare is a business, which I think is a great transition to talk about the next up on our timeline. In 1951, I think hopefully at this point in history, a lot of people know about Henrietta Lacks, who was a young woman who had passed away from cancer, from cervical cancer. And she believed she was a patient at Johns Hopkins at the time. And that's where she also, I think, passed away. And medical researchers at that university ended up using her cancer cells. And these cells were so well used and known that they even had a name, HeLa. I think that's how I'm pronouncing it. HeLa cells, because they were just used from everything to create drugs, to eliminate toxins, hormones, and even to help come up with a vaccine for polio, which is all great and dandy. We love that she was able to help society and help the medical world. But the whole time, her family had no idea this was happening, and they were not compensated for this. I think really until the 21st century, her family uh, started to get some sort of compensation. I think I'm not 100% sure about that. Um, and the thing is, and I think this is sometime where medical and science and this overall justice, where lines can blur, because you'll have scientists who are like, well, we got to keep advancing history. We got to have a cure for this, that, and another. We ain't saying that you don't. Um, but you need to get consent. And the woman had passed away. She had a whole family. She had a number of children whose children grew up and they had families. So it was, I think, a pretty large family.
Yeah.
And none of these people they had gotten consent from to be able to do this. And again, that goes back to Johns Hopkins believing that because she was a woman, she was a Black woman, that they could get away with this. I'm sure if this was Betty Sue, the situations would have been different. They might would have still have used her sales to help with all these cures and things like that. That they probably would have gotten consent. And because she's a Black woman, where was the consent? They just decided, oh wow, her sales are really working. Let's take this to the next level. Let's not tell her family. And I just think that's so shitty. And anybody who says that it's not shitty is an asshole. That's all I'm gonna say about that.
Mic drop there.
Mic drop. That's a girl, because that's fucking horrible. To use somebody's body without consent, even if you donate organs, they have to have consent for that. When people pass away and they have it on their driver's license, which I've heard shit about that too. It's a little fucked up. That might be another episode.
That might be another episode.
But you're supposed to get consent for these things.
It's interesting because I went as you were kind of talking or reading the timeline portion of it. I went and looked. I just kind of Googled her name really quickly because I was wondering if it was John Hopkins. It is John Hopkins. And they have a whole site like this page on their website about honoring Henrietta Lacks. And one of the things that's on here that they put is Johns Hopkins has never sold or profited from the discovery or distribution of the cells and does not own the rights to the cell line. So they offered the cells freely and widely for scientific research. So you can tell they're trying to cover.
They're trying to cover the tracks. Yeah, they shouldn't own anybody. Her family should have ownership over that distribution.
And then they say we should have done more to inform and work with members of Henrietta Lacks' family out of respect for them, their privacy, and their personal interests. And then this is the sentence that, as you were talking about consent, they actually address it, and they're like, though the collection and use of Henrietta Lacks cells in research was an acceptable and legal practice in the 1950s, such a practice would not happen today without the patient's consent.
And that's why we have shit like the IRB, which makes sure it's probably that. I'm sure that is just one case. I mean, we're not going to touch too much on the Tuskegee experiment. That one is very well known. But that's another reason why we have IRB. I've had to fill out IRB and go through the process, and it's very irritating. But it is a reason that is in place because of these situations that have happened. And so, yeah, as you said, John Hopkins was a very well-known medical school in the country and in the world, and which it doesn't mean much. They still fucked up, but they are trying to cover their tracks. And yeah, I think there is some sort of memorial. They've tried to make their wrongs right, which I'm all for people doing right, and apologizing for what they did to her and to her family. But yeah, that is the fact that was even legal, and they say it was legal. I'm not gonna go look it up because I don't know, but they said that was legal.
That's me.
That is very surprising to just
think
steal
about women in general.
Yeah,
it's not surprising when you think about just women in general, and then you kind of get into the black women and other women of color. Like, it wouldn't surprise me that it wouldn't have been illegal for them to do it because men think that they can do whatever they want at any point. and things. So I can see it. I'm curious. Like I don't know what triggered it to become illegal at some point. Like when did it become illegal? Like I wish they would like.
It's probably somebody white. Somebody white probably went through the same thing, a family,
Yeah,
and
something happened.
their voices got elevated and got heard. Probably that's what
Yeah, so
happened.
I'll be curious at what point in history, if anybody knows, please comment
Yeah, please let you know,
let us
because
know, because I'll be curious to
let us
know
know.
when it did not become an acceptable and legal practice.
Yeah, which is
Um,
very disturbing. Like I said,
I'm
not
like
so much a shock,
1950s is not that
but it's very disturbing. But there's a lot of things on the timeline that we're not going to have time to cover. But like Lisette said, I'm just rambling because it's just so much going on in my mind. We will link to the timeline, but I mean, we can go back to the supposed father of modern gynecology, Sims, who experimented on black slaves, and he tortured them. So you know, um, but I think this was an overview. I hope this gave people who are listening again and watching. I hope you're curious because, like I said, we haven't even really touched the iceberg on how we got to this point and how we've been at this point. Not much has changed. And again, we really just touched on it from an African American perspective. We got our Native Americans, we got our Latinos, we got our Asian sister and brothers out there. We got poor whites who have been experimented on. There's a big gamut out there. So I hope this piqued people's interest to go and look into this and learn more and even look at ways that you can make a difference. I know it always seems like these things are bigger than us, and they are, I think, but there's always something that, even if it's just a small gesture, or something that we could do. So with that, I'll turn it over to Lisette to wrap us on up.
yeah, I think I'll echo what you said, Martina. I hope people go in. We will make sure to link the timeline, the link to the timeline that we're kind of looking at, so you all can see it as well and kind of learn from it, and and do a little bit of research. I think our episode this week really just, we wanted to just have a conversation and do sort of like what we've done in the past, have like a live sort of conversation around these things, and share a little bit what we've researched and learned. And I think we're going to continue. I think we'll come back because I know Martina mentioned the father of modern gynecology, and if you're listening, I was on quote unquote on that, because even the history of that and how it started, and it's terrible. And
There, my
um
sisters.
and I think we'll kind of dig in a little bit on that portion of the timeline and the talks, and we'll, us as women of color, will probably share a little bit more about our perspectives on
Yeah,
just women's health in general, maybe on that, on next week's episode. But yeah, I will, like I mentioned, we'll put the link in there. Let us know if you have any questions. Please like, follow, share this out with those of you who think would be interested in kind of learning more about this. And we will be back with more topics and more conversations for you. So
see
have
y'all
a
soon.
good rest of your day, evening, wherever you're at.
Wherever you are, whatever time zone, we welcome all.
Yes. All right. Bye, everyone.
Bye.